with the bladder dysfunction, what we're doing is we're doing an examination of the bladder using a cystoscope, which is a telescope where we can look at the inside of the bladder. We then guide a needle into the wall of the bladder to do a tiny injection of a very small amount of the toxin. And we do that at several points throughout the bladder wall, so it infiltrates the muscle of the bladder and provides a powerful opposition for the inappropriate bladder contractions that are causing these symptoms. So it's injection therapy direct into the bladder. It basically lasts for about a year and has to be repeated at intervals thereafter. It varies from patient to patient. This was investigated in some large-scale international trials that looked at the specific conditions of what we've just described, overactive bladder, and also people with neurological. So they decided the best dose for maximum efficacy and safety for the clinical groups. So it's 100 units for people with overactive bladder and 200 units for people with neurological disease with a severe urgency incontinence situation. We've really introduced this in just the last 3 years that it's become mainstream practice. First experimental testing is perhaps 10 to 15 years ago. So it's a very recent development. And of course you go very carefully checking safety and efficacy, which is why it takes some time to develop. The side effects are, it is actually very well tolerated, but you do choose your patients carefully, and that way you can avoid any concerns like if it's somebody that can't pass urine afterwards, they are happy to use a tube to empty their bladder for that temporary basis. And that way we've got some very good outcomes.